I'm Dr. Nadeem Sajjad Raja. You are watching my YouTube channel, Dr. Raja Nadeem Sajjad Official. Please do subscribe my channel and press bell icon button. Today I'm going to talk about chronic fatigue syndrome. Chronic fatigue syndrome is really a very interesting topic. A lot of research is being done on this syndrome to establish the cause of chronic fatigue syndrome. So another name of chronic fatigue syndrome is myalgic encephalomyelitis. But recently, the medics, scientists have given a new name, systemic exertional intolerance disease. So chronic fatigue syndrome is a complicated disorder characterized by extreme fatigue, which usually lasts 6 months. So the main symptoms are sleep that isn't refreshing, difficulties with memory, focus and concentration, dizziness that worsens with moving from lying down or sitting or standing. Some people say that different viruses cause chronic fatigue syndrome. Some people suggest chronic fatigue syndrome is due to depression or anxiety. So what are the common signs and symptoms of chronic fatigue syndrome? So the signs and symptoms vary from person to person, but important are fatigue, problem with memory or concentration, sore throat, headache, enlarged lymph nodes in the neck area or armpits, unrefreshing sleep, unexplained muscle or joint pains, extreme exhaustion. So what are the common causes of chronic fatigue syndrome? So for example, as I mentioned earlier, viral infections. Some people develop chronic fatigue syndrome after suffering with viral infection. For example, Epstein-Barr virus, human herpes virus number 6. But so far, these researchers haven't established a conclusive link between viruses and chronic fatigue syndrome. Other causes include immune system problems. For example, if person's immune system is weakened, so he may suffer with chronic fatigue syndrome. Hormone imbalance, for example, hypothalamus, pituitary gland, adrenal gland, or thyroid gland, if they are underactive or overactive, then person might suffer with chronic fatigue syndrome. Physical or emotional trauma. Some people report that they experienced an injury, surgery, or significant emotional stress shortly before developing chronic fatigue syndrome. So who are at risk of suffering with chronic fatigue syndrome? It can affect any person of any age, but mostly people suffer during their, either they are young or middle-aged people. Women report more chronic fatigue syndrome as compared to men. So what are the common complications due to chronic fatigue syndrome? That person cannot carry out daily or routine tasks, stay away from the work, so increases work absences, social isolation, because find it difficult to socialize with other people, may suffer with anxiety or depression. So how chronic fatigue syndrome is diagnosed? There is no single test to diagnose chronic fatigue syndrome, but usually, so sleep disorders are ruled out. So for example, patient is suffering from sleep apnea, or also rule out sleep lag syndrome or insomnia. Rule out medical problems, for example, anemia, diabetes, underactive thyroid gland, and check the bloods for other thyroid, gland functions. Also rule out whether patient is suffering from any mental health issues. So definitive diagnostic criteria. According to United States Institute of Medicine, fatigue is so severe that interferes with daily life, or new or definitive onset of chronic fatigue syndrome. It is not elevated by the rest, and it is worsened by the physical activity, mental activity, or emotional activity. And it also impairs the memory, and patient feels dizzy. So how chronic fatigue syndrome is treated? Different medications are used, for example, for anxiety, for depression, if person is having pain, body aches, joint pains, then painkillers, and also underlying medical problems are treated. This patient is also offered counseling, and if suffering with any sleep problems, then doctor or medics, they choose treatment and suggest treatment for sleep disorders. Patient is also advised to do regular exercise. Thank you very much for watching this video. If you have any questions, please write down in the comments. I will answer all your queries. Thank you.